I'm not saying much, but HMO patients, please, what is the rationale behind bringing healthy children, perfectly healthy children without any problem or any complaint to the hospital to just use your HMO? Doctor, this one, you have a kata. This one doesn't like to be eaten.
I spoke earlier in one of my episodes about people really abusing the system or abusing HMO plans. And then they come back thinking they are trying to not allow their money waste or allow HMO chop their money. It doesn't really work like that. I don't think it's fair. Most people don't understand the implication of just taking your whole family. Let's say you have a family plan and taking your whole family to the hospital and just taking medication just because you feel you don't want your HMO to eat your money. I can assure you, I've told you guys before, aside from the fact that it's a business, the healthy is always taking care of the sick. There is a pool of funds that comes together. Somebody is spending the money. The money is not just that. If you're not falling sick, especially if you're in a corporate plan, there's somebody that has used the money. Even if you're in a retail plan, for example, and one member of your family does surgery or does a very expensive type of care and others don't, that doesn't mean there's one special money being kept there. It's because of the fact that in HMO, we win some, we lose some. That's how we say it. Don't think that, because if you don't go to the hospital to access care, your money is just wasting. That's the mindset that you might think is wasting. No, not necessarily. The time that you might need it, the HMO might deny that care. That's why some of you will come back and say, HMO is a scam. Because the days you don't need it, or members of your family that are under the plan don't need it, you will carry them to the hospital and go and be collecting medication. When medication is not food. Drugs on their own have side effects. Why take it? Please, it is important to use your HMO plan when needed. Not because you feel like the HMO is eating your money. HMOs are not eating your money.